Thank you very much, and I am very happy that this workshop has been organized together with ecancer and the University of Milan. I think that the title is very timely because precision medicine is coming up today to be a revolution in the way of prevention and treatment. Okay, so precision medicine is an innovation approach, as I said, to disease prevention and treatment. And what is new is that it takes into account the genetic, the environmental, and the lifestyle factor of the people. So all three different, with this different approach, this should lead to make a way to prevent, and together with a big data set that will be produced with the new technical ways that we will see. And this precision medicine was launched by Barack Obama in 2015. So why now? The time, as I say, is right because we have the sequencing of the humans with all the omics that we will see. We have all improved technology for biomedical analysis. All imaging has been very focused and very narrow on cell and also on molecules that are inside the cell. And then there are new tools for analyzing big and large data sets that are produced by the omics and by all the technological analysis. I said omics because, as you know, we can address and sequence not only the genome, and by this we can have an approach to pharmacogenomics, nutrigenomics, and toxicogenomics. But then now, and very recently, we can sequence the epigenomics. And as you know, we talk about epigenome considering all the change that happen in the chromatin at the level of histone, but also methylation, for example, at the level of DNA. And not only epigenomics, but we can, from genomics and epigenomics, we can have all the transcriptomics. We have large data sets about not only mRNA, but also miRNA and also long non-coding RNA that what we understand now are regulating also at the post-transcriptional level the activity of the gene. And then we have proteomics with and interactomics and metabolomics. So you see that from an individual, but also from a tissue or from a specific type of cell, we can have important information. And all this will generate a big data set. In fact, the NGS revolution has been really a revolution in the way we can have extract information. And the sequencing, the resequencing of the genome now is very cheap. compared to what it was at the beginning with the two sequence of Craig Venter and James Watson. And has been in UK launched the 100,000 genome project. But we can resequence multiple genomes of an individual because we can sequence, we can extract somatic cell, specific somatic cell, and we can sequence that. And of course, we can sequence the genome of cancer cell. And then what is coming up today is that we can sequence the epigenome not only as a standard, but we can sequence the epigenome according to a different stress, according to the lifestyle and along the life of an individual, so from when it's young to when is adult. And so this gives us the opportunity to have information that in the past we couldn't have. And we receive the information of how the environment, of how the food that we eat can change our epigenome. And this is very important to take in account. I took this quite old slide, but it's very important because I think that in the kind of personalized medicine, but then we are now in precision medicine, you can see that in the standard way we cure people, you see that probably only 1/3, if you give a chemotherapy, not based on precise biomarker. Only 1/3 of the people can take advantage. And then the other 2/3 doesn't have any advantage or is even toxic. Now, if we can have analysis of different tissue of an individual, and we can make precise analysis using biomarker, then we can give the exact type of drug they need. And so this not only will have an advantage for the life of the people, but will have also an advantage in terms of economics for the sanitary system. So we have this shift from the past to a precise medicine that is based also on algorithm. Because, as I said, all the data we can get will go into this big data set that will be analyzed using algorithm. But also, with all this information, we can, according to the type of disease, we can think to do gene therapy, but in a different way. We can use gene editing. We have also areas of regenerative medicine with artificial organs. Here you see the first organs, but probably is an artificial bladder. And then we can have tissue engineering using different biomaterials to do scaffold, to do knees. But we have also to go not only in precise medicine, but also in gender medicine. And then the other revolution is to have body sensor. We can have sensors that are implanted in the body, and this will give information but will go to a computer and then will come back to the body. And for example, if one has diabetes, will give the information of how much insulin should be given. Here, there is this project of this Google Lens, but is not finished yet, but as a sensor in the lens that can use this sensor to understand how much is the concentration of sugar inside the tears that are present in the, and this sensor then can give, send the message to a computer. Also, this sensor can be implanted. Maybe this gets scarce to have a sensor implanted in our head, and this again can give for neuroscience a lot of information. But one of the most practical, let's say, information is for artificial, for example, in this case, arm. But you think to move the arm, and through the sensor, you send the information, and the arm moves. So all these are different approaches that we can have in the future. I'm going to finish, but you have to think that you need a cooperation, a collaboration between the scientific community, the university, all the science, the pharma industry, health authority, regulator authority, integration of hospital and tertiary health care and patient association. So it is the kind to reach where we want to go. This needs an integrated approach by all the different actors. And then, as last point to be discussed are ethics, privacy, social impact, economical impact, and new model for healthcare system, and maybe other points. So I thank you for your attention, and thanks a lot.